Thank you. Good evening, everyone. This is Dr. Frank McMillan Jr., Chairman of the North Andover Board of Health. This is the April 23rd meeting. It's now 7 o'clock. This meeting is being recorded, and this meeting is being held on an internet platform due to the COVID-19 emergency. And Brian, I don't have the language in front of me, but the open meeting law portion that prevents us from having that requires us to have an in-person meeting has been suspended by the governor's emergency order. With that, I will say welcome to everybody. The first item of business will be an update from Brian and our colleagues in the health department, Stephen and Caroline. Brian, I'm going to give you the floor. Go ahead.
All right, thanks, Frank. Just give you guys a quick little rundown of everything that's going on since the last time we talked as a group. I think that was April 9th, and it was about 2 weeks ago. At that time, there were just about 19,000 positive cases in Massachusetts. It's been 2 weeks since then, and as of today, at 4:30, it's been up. It rose up to 46,000. So we've more than doubled the entire case count in Massachusetts since our last meeting. As of right now, we have just over 120 positive cases here in town. So we're definitely getting up there in terms of overall numbers statewide. Ours has been slowly creeping up. We're supposed to be around the peak now from what the predictions were. The numbers are still going up by 1,000 to 2,000 every day. So we might not have plateaued yet, but we're slowly creeping up. Hopefully it does level off soon and we can reach the peak and kind of maintain a status quo for a little while, and then can start getting back to the new normal. As of right now, the last time I checked, which was earlier today, Lawrence General Hospital and Holy Family each had 18 of their ICU beds full. So that's 36 in total. Massachusetts, as a state across the board, has about 10% capacity left in their ICUs. Testing is still increasing. Obviously, as supplies and lab capacity is built up, testing is increasing slowly, which is a good thing. One thing that we're talking about in the public health world is the transmission rate. Transmission rate right now for COVID-19 is designated at 1.25. So what that is for every one person that's infected, they are transmitting it to 1.25 people. And that is with all of the social distancing, all the mask wearing, the protocols, everything that we're doing has basically limited it to 1.25 people per infected person. So it's still going to go up no matter what we do. What they're looking to do as the next phase is contact tracing. Because if it's at 1.25 now, it's due to asymptomatic transmission, which if we can do better contact tracing as a state, we can limit the people that are getting infected and reduce that R number to below 1. We're still a ways away from overall antibody testing. I don't know if you guys have heard a little bit about this. You can talk about it more. Now, the FDA hasn't approved any type of platform yet for that. They are, last I heard, they were trying to figure out how long it takes before somebody actually has the antibodies built up when they're infected, and to how long it lasts in their bloodstream once the infection is gone. I'm also still waiting on more information from Dr. Zapata, who is going to be opening up a drive-through testing site at the Andover Doctors Park. Last conversation I had with him was late last week. He was having trouble with the state and red tape in getting the testing site approved by DPH. So there's a lot of paperwork and documentation that goes along with that, which is one of the things that he's running into at this point. But hopefully we have a local testing site up that's going to be open every day, and we can kind of keep our testing numbers up there. The National Guard is also available to do testing at long-term care facilities for residents and staff members. That is a new program that's been rolling out across the state. One community has actually made it mandatory for all their long-term cares to get tested for all the staff and all the residents. We're not at that point yet. We have had some conversations with our long-term care facilities. We had a conference call this afternoon with 2 out of the 4 just to discuss their procedures, PPE use, reporting, talk to the state epidemiologists that are handling their facilities to get input from them and insight from them as to what's going on and how to best support them in this entire process. I did just get an order of face masks from MEMA and have been given out to companies and to supporting agencies. I also got face masks shipped from a company in Newton, New Hampshire that I have given out some to the food protection workers that are doing the food program here in town. Obviously, we're going to go on to the order that we have on the agenda later on tonight. We can talk about that. I did a PSA last Friday on proper mask and glove use that NACAM got out there and kind of trying to teach people about how to use these things correctly, because you see people using masks and gloves completely incorrectly all across town. So I'd like to get some information out there on that to help people. We did put out the one-way walking signs at the Common and the track. We have had some negative feedback for that, but I think as a board, and I think what we did with that to limit people's exposure going face to face is definitely a good thing. We are still discussing with other public health entities in the state about semi-public pools, camps, golf courses, boat ramps, all that stuff that's going to be coming up at this time of year, and the best way to kind of move forward. Nothing has been decided yet. Obviously, schools are now closed for the remainder of the season. A lot of people are wondering what that's going to do to people getting back to work. If there are no camps and no school, that's hard to get back to work if you have children. So that's being discussed at the upper levels in the state. They are thinking about it, trying to figure out how to best move forward once we do get to that point, whether it's next month or the month after. It's going to eventually be a hot topic and something we're going to have to address. As a department, we're still getting calls and complaints and questions from residents and businesses. I think one of the big ones we got this week that we were kind of laughing about was somebody calling their neighbor for having a birthday party of over 10 people. As of right now, I'm not the birthday party police. We have a lot of things we're working on, and that's not quite there yet, but we do appreciate people looking out and at least letting us know what's going on so we have a pulse and some feedback of what people are doing in town. There hasn't been a lot of that, which is good, but those things are popping up and we are doing that. Building permits are moving along as normal. Septic plans are still coming through. Septic installations are still going on. Title V's are still coming in. The housing market is still moving along. Houses are still being sold and we still have to do their Title V's. And then the last topic that has been coming around was the issue with cats. Obviously, since the Bronx Zoo story came out a couple weeks ago, people have been talking about pets and animal, transmission. And as of right now, cats and ferrets have caught the COVID-19 from people, but there's been no indication or any evidence that it can transmit from a feline to a human at this point. So I'm going to pass it off to Caroline and have her give you an update on contact tracing and what she's doing and long-term care facilities.
Hi. So just to kind of piggyback onto what Brian was talking about, right now in the town we have 137 cases. 80 of those are recovered, and out of isolation we have had a total of 7 deaths. In terms of what I am doing, as well as I have some of the school nurses helping me, is the contact tracing from which we've been doing, which we kind of have done before COVID came around, but it's important, especially with this virus, because it is so contagious, and we're looking at, the time frame 48 hours beforehand, as well as anyone when they were symptomatic. So we're doing all that contact tracing with any positive cases. If they are healthcare nurses, CNAs, we're looking at who they had contact with, and then touching base with those people and putting them in quarantine. There is a statewide program that is being rolled out. They have 25 communities that are in the works of using that contact tracing. I think they have 1,900 volunteers who are helping out with that piece. Local boards of health are still taking on cases, especially the ones that are complex, like the long-term care facilities, but anything that is flagged and needs assistance just due to, staffing needs or whatnot, the contact tracers will take that over. So the next phase will be in the next week or so. They'll roll out like another third of the communities, I believe. And then by May 1st, all of Massachusetts will be able to use that service. And in terms of the long-term care facilities, like Brian said, we had a conference call with two of them just to, it's hard when you have an epi involved. You have the epidemiologist, you have the local board of health, you have, who they're dealing with, infection control and, directors and whatnot. So it's good to kind of get all of those heads into one conversation, make sure everyone's on board. And it kind of clarifies what we're looking at for, the facility and what everyone's doing and implementing. And, so we had a conference call with them, and we continue to work with them on an individual basis. They're all very unique and have, different needs in terms of staffing and PPE and, infection control. So that's pretty much it for right now for me.
Okay, thanks, Caroline. And then I'll have Steve give a quick update as well. Steve?
Hey guys, so as of the last time we talked, I've pretty much been following up and checking in with grocery stores, just taking and responding to complaints or calls as needed. I've been trying to keep or do at least a drive-by of common areas like the North Andover Common, I believe it's called Memorial Park, and some of the other fields in town, just to make sure they're not getting overwhelmed with people, especially since it's getting nice out. I've been trying to draft some information for pools, and obviously what we have to talk about later regarding the grocery stores and food retailers. We did put out some PSAs. We put out one on exercising in public areas just so people can stay safe as they are getting outdoors and exercising. And then Brian had drafted something last week when we got that nasty storm related to food safety during power outages. I've been trying to keep in touch with restaurants as needed, and I'm hoping to send out an email tomorrow just reminding people that even though the weather's getting nice out, patio seating and outdoor seating still applies to on-premise consumption of food and drink, just to try and be proactive on that end. And then just trying to help out wherever else I can. I helped out Deanna, the community support coordinator, with a food delivery the other day, so basically trying to just lend a hand where needed.
All right, thanks. One thing I didn't mention before was PPE. I know there's been a shortage. I think production is starting to catch up to the demand. It's not there yet, but we are getting PPE and supplies in from MEMA that we can disperse to long-term care and things like that. So we have some stuff coming in at this point, and we are on our way to hopefully getting enough. So back to you, Frank.
Yeah, so just a couple of things. I do have the language in front of me right now, and I'm just going to read it into the minutes. And it's pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Laws, Chapter 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and general guidelines for remote participation by members of the public and/or parties with a right and/or a requirement to attend this meeting can be found on the town website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on their televisions by tuning to Comcast Channel 8, Verizon Channel 26, or online at www.northandovercam.org. No in-person attendance of members of the public will be permitted at this meeting, but every effort will be made to ensure that the public may adequately access the proceedings in real time via technology means. In the event that we are unable to do so, despite our best efforts, we will post on the town meeting website an audio or video recording, transcript, or other comprehensive record of the proceedings as soon as possible after the meeting. We do not have any public hearings today, so I will dispense with the next sentence. I also want to just put out a matter for general consent since Joe McCarthy is not on the call. He is our secretary.
Oh, I am on the call. I've been on the call
Okay. Okay, so far, the first items that we've dealt with are just informational. Joe, we have some meeting minutes that are ready for approval. Would you like to make any motions to that effect?
Yeah, you're talking about the meeting minutes for March the 26th. They have been critiqued, and I make a motion that they are approved.
Is there any objection to approving the meetings with the meeting minutes without corrections? Hearing none, I'll take that as a general acceptance or acclamation, and the meeting minutes are approved, and we will dispense with a roll.
What about the supplemental meetings that we are having in addition to the regular monthly meetings? Are there going to be meeting minutes on all of them too?
I'll let Tony comment on that.
Yes, you'll receive minutes from all the meetings.
Thank you, Tony.
Okay, and just as we were about to go on to the next item, I just closed the window and I have to open it up again. I will leave the I'll leave the floor open to comments on Brian Caroline's or Stephen's presentation while I'm pulling up the next item.
Yeah, I'd like to start. I have several questions. The first one probably to Carolyn. Although the schools will be closed until at least September, the daycares facilities will be opened as soon as June the 30th. Do we know if that includes camps too, or just daycare facilities?
We
I can
don't
take that,
know at
Carolyn.
this time. Yes.
Okay. Yeah, basically, yeah.
Oh, so it does include camps. Okay. And a question to you, Brian. You said that you talked about testing sites, and I have read that the results can be available within 5 or 10 minutes. But the sites that we have and will have, how long will it take to get the results once one is tested?
It depends. I think the rapid testing sites are under 10 minutes for a positive, up to 15 minutes for a negative. Sometimes they have to send them to a lab, and it's 24 to 48 hours, depending on what site you go.
Where are these rapid test sites?
Right now, they have one in Lowell, run by CVS as a rapid testing site.
Okay, so the ones, for example, at the hospitals that you mentioned, they are not rapid test sites?
No,
Still
they
know
are.
off the top of my head. Okay, thanks, Caroline.
Yeah, they are. And AFC Urgent Care is also doing rapid testing.
Oh,
Thank you.
okay.
Yep.
And you need a doctor's order, or you can just show up?
So it depends. So the AFC Urgent Care will usually screen you ahead of time and kind of make an appointment. Same with the CVS in Lowell. For the Holy Family in Lawrence General, you do need a doctor's order. I don't know if that's changed recently, but that is how it was a couple of weeks ago.
Yep.
Thanks for clarifying.
Those are the only questions I have.
All right, thanks, Joe.
Hey, Brian, I have a question for you.
Department head.
Okay.
Brian, is TPH talking to bordering states, with hospitals reaching their capacities in Massachusetts? Is there any thought about patients being transferred to cross-state borders, Rhode Island, New Hampshire, even into Maine, for these patients to be safely taken care of?
You know what? I have not talked to him about state-to-state patient transport at this point. I think because we still have capacity, that hasn't come up in any of our state conference calls. I think depending on which region you're in, if there's a catchment area for, say, Region 3 CMed, and Lawrence General is full and Holy Family is full, maybe there's something in Salem, New Hampshire, or something close by that is not full, but they could transfer patients to. But I think that's all done by CMed, and that might be on a state-to-state basis.
Okay.
Are there any other questions? I have a question, Brian. You had mentioned about the proper use of masking and using it incorrectly. And would you mind just going over with us what the benefit of wearing a mask is, why you want to cover the mouth and the nose, what is the purpose, how does it work, what are the best practices?
Sure. Obviously, we talked about this at the last meeting we had, and a surgical mask is good for a few different things. One of the things that it's really good for is protecting the patient from the surgeon if the surgeon has an infection. So by using a mask properly, you hold it and put it on by the ear loops or the straps. You keep your hands away from the cloth itself so you don't contaminate the cloth or contaminate your hands if the cloth is contaminated or the disposable fabric. So by putting a mask on, any secretions that you have from your respiratory tract, such as talking, breathing, coughing, sneezing, is caught by the mask and won't affect people around you. So there's a little cartoon that I sent you guys that has good, better, and best. So if you have a person that is healthy and a person who is unhealthy and the person has a mask on who's healthy, it gives you a little bit of protection. If the person with who is sick has a mask on and the person who's healthy doesn't have a mask on, that gives you a whole lot more protection from getting sick. If you both have masks on, that's double protection, and that's a really good thing to keep you, as a healthy person, from contracting the virus through airborne respiratory particles. Masks are also really good to keep you from touching your nose and mouth with your hands. As long as you take it off and put it on properly by the ear loops or the straps only, it will protect you and keep you safe from transmitting the virus to yourself. The PSA I did went through the 3 different kinds of masks. Obviously, there's the N95, which is a respirator that comes in different sizes, has to be fit tested. So you have to have the right size. You have to know how to put it on. You have to know how to cinch it around the nose and keep yourself from breathing through the sides of the mask and just through breathing through the respirator portion of it. That's reserved mostly for healthcare workers who are dealing with and handling patients that have COVID-19 or any type of transmissible disease. Then there's your cloth surgical mask and your disposable surgical mask. Cloth, the ones people are making, you can get them all around town. Those give you some protection, as well as the disposable ones. And those are the ones you want to have on hand and wearing out and about in public.
So, Brian, so you mentioned early in your presentation about the transmission of the virus and that how our O-U-R, letter R, value in Massachusetts is at 1.25. And so what that means is a person who may be asymptomatic with COVID is spreading the virus to 1.25 persons. Now, early in the epidemic, we were seeing R values of 3 and 4, where one person was spreading it to 3 other people, and that's how you get the exponential acceleration of the disease. And so, can you explain the value of using masking in relation to the R value and the exponential benefit that the public gets when people wear masks fairly universally? Did I?
Okay, yeah. So like I said in the beginning, when they calculate out the R value, that's the transmission rate of this particular virus. Before any social distancing, when people were out and about doing what their regular day, asymptomatic people were transmitting it to 4 to 5 people per one infected person. So that gives you your exponential growth where that bell curve shoots straight up, goes right past the capacity of the hospitals, and then you end up with a situation like Italy, which obviously we wanted to avoid at all costs. By social distancing, you reduce the transmission because people aren't together as much. It still transmits at this rate, 1.25 per one sick person, and that does help flatten the curve. But it's still above 1, so you're still going to be increasing. By a sick person wearing a mask, it protects the person next to them, and these are just guesstimates from other types of respiratory diseases such as influenza, will protect you literally like 80%, 90% protection when the sick person has a mask on. If you have a mask on and you're next to a sick person who doesn't have a mask on, it's say 10 or 20% transmission rate. So by both wearing masks, you reduce that to about a 1% transmission rate by everybody wearing a mask, and that will reduce the spread even more, probably below the 1.25 R value.
That's an excellent explanation. Does anybody have any comment about that? Because that's going to be the basis for our one action item for tonight. Hearing none, let's see. We have one item in front of us. Has everybody had a chance to see the proposed emergency order? Has anybody not seen it?
It was revised today too, I believe.
Yes,
Yes.
a couple comments that Frank had, we included in there.
So I think it would be helpful. I think we probably need to read this into the minute just so that it gets recorded. Pardon me for filibustering here. But what we have before us is an emergency order for employees of grocery stores and other food retailers. Pursuant to the North Andover Board of Selectmen's declaration of a state of emergency on March 18th, 2020, and in accordance with Mass General Laws, Chapter 111, Section 31, 310 CMR 11.05, 105 CMR 300.200, and all other authorizing statutes and regulations, the Board of Health of the town of North Andover, in order to take additional measures to protect the public health during the COVID-19 public health emergency, in light of current conditions, including ongoing person-to-person community transmission of COVID-19 cases caused by the SARS-CoV-2 virus, which may occur among asymptomatic individuals, hereby orders the following with respect to food retailers and grocery stores operating within the town of North Andover. All employees in public-facing areas of all grocery stores and other food retailers open to the public shall wear a facial covering over the mouth and nose. It is also strongly recommended by the Board of Health that employees in non-public facing areas wear masks except where impractical, like eating, to reduce transmission of SARS-CoV-2 virus to other employees. This can be satisfied by using a disposable mask or cloth covering such as a fabric mask, scarf, bandana, or other covering that covers the mouth and nose. For guidance on making your own facial covering, please see the link called Making Your Own Mask document from the Health Department. The North Andover Board of Health also strongly recommends to the public that those entering grocery establishments and other food retailers cover the nose and the mouth where practical while in the establishment in order to reduce the chance of transmitting the SARS-CoV-2 virus to other shoppers and to employees. This order is effective beginning April 24, 2020 at 12:01 a.m. and shall remain in effect until the Board of Health in its judgment determines that the public health emergency no longer exists and terminates the order. To the extent necessary, this order shall be enforced by Board of Health officials, North Andover police officers, and North Andover building inspectors. So that's the item of business that's before us. Open for comments.
And Joe McCarthy, is this being done in any other community surrounding Andover?
Yes, several other communities have done this and even gone a little bit further. I think with insight and some guidance from the AG's office, we're going to limit it to what we have here. I think this is a good representation of what we should do. I know that other towns have done other business as well, but I think the main thing is the food retailers at this point. This is where we should target. But yes, so it has been done in several other communities across the board.
Yeah, and I've been to probably all the food retailers here in North Andover over the last couple of weeks, and the vast majority of their employees are wearing some type of facial protection. a concern that I have, though, on this coming May the 4th, 11 days from now, the governor may start a phased withdrawal of actions taken to address this virus. And as such, is this additional measure of protection really required at this particular time? I'm asking, not telling. I think it's very well written. It makes sense, but is it? That's one more thing to do when the state is looking at doing fewer things, as well as many other states. For example, in Georgia today, they're pretty much in phase 1 of getting back to normalcy, whatever that is in this day and age, as well as other states like South Carolina and Tennessee, to a lesser extent, Texas, Florida, and so forth. And yet here we are, we're talking about doing more, and yet 11 days, the governor may be doing less. So I'm struggling with this. I don't have a strong sense one way or the other. I really don't.
So Joe, can I try to take a stab at that?
Absolutely.
All right. So you know, there's all these cliches that have come out of the last month and a half. You know, flatten the curve, social distancing, in an abundance of caution. I mean, it becomes nauseating. There's so many of them. But I don't think we're trying to flatten the curve. I think what we're trying to do is crush the curve. And I think it comes down to the science of the R value. And it's a mathematical multiplication, that what we're trying to do is, if you think about the people in the grocery stores, that clerk in Market Basket might have 200 or 300 people go past him or her. And so what we have is a presumption that there's community transmission. And that community transmission might be the person who's contacting 200 or 300 people a day. And so the idea of this is to protect the public that's just trying to do something innocent, like get food, from possibly being exposed to somebody who's exposed to everybody else in town. And I think when you think about it that way, that it might make sense, because if you're going to do testing and tracing, wouldn't you like to do the testing and tracing among the fewest number of people possible, and not flatten the curve, but crush the curve? And so that's the rationale for coming up with this.
Well, you mentioned crushing the curve, but until there is a shot developed to prevent catching the virus, and until there is improved medicines to treat the virus is still going to be here. And so all you're really doing, especially when the governments of different states start putting the states back to a measure of normalcy on a phased basis, then what you're going to have logic says to me, is an uptake in the cases of the coronavirus, because so many people, particularly seniors right now, I know so many that are totally isolated, don't go anywhere. But once these restrictions are removed, people will be more prone to catching the coronavirus. And so to me, to an extent, it's a question of, are you going to catch it today, or are you going to catch it tomorrow?
Well, if your chances of catching it, Joe, are very high, and we reduce them to under 1% by having a lot of people masked, what it actually does is it enhances your freedom to go out, because you'll know that your trip to the grocery store is going to be a low risk exposure. So it actually enhances your freedom to get out. Now, you may choose not to go out, and that's fine. And I'm not going to second guess anybody's judgment about whether they should go out or not. If they're running a fever, then I will second guess their judgment, because they shouldn't be doing it. But if we do something like this and we reduce the transmission in the community to a very low level, it actually makes it more possible to open up other businesses at an earlier date. And it makes it more likely that a strategy of contain, test, identify, contain, and isolate may not cure the COVID virus, but it'll keep its incidence so low that whenever we see it pop up, we can do the contact tracing, and we can actually get ahead of it, anticipating at some point that we may have a treatment or a preventative. but let's be honest. I mean, the information that this works comes not from coronavirus transmission, but it comes from influenza virus transmission. We know this works in influenza. We hope that it works in corona. We don't have other tools right now, so that's where it's coming from.
And the few times that I've been out shopping, the grocery shopping and so forth, I mean, I always wear a mask right now. And I tell you, the thought of wearing a mask for 8 hours a day is absolutely unfathomable to me.
Welcome
They
to my world.
are so uncomfortable. And even when I'm out for like a half hour or so, I just can't wait to take it off and say, my goodness, if I was a young man working right now and I had to wear a mask 8 hours a day, I don't know how they do it. I don't know. So
Well, their temporary discomfort might actually save a life.
well, it's another way of looking at it. The temporary discomfort may actually prolong a death. Other than now, it may happen later. You know,
Well,
who knows?
Any other?
I guess one thing to think about too, Frank and Joe and everybody, is that some of the things that we've seen so far with the essential food retail employees is that if somebody is diagnosed with COVID-19, then we do the contact tracing, and if they're at work within the last 2 days, then we have to isolate the patient and quarantine the people they were in contact with, which includes 5 to 6 other food retail employees. So by them protecting themselves more, it decreases the chance of us having to quarantine people that are actually out there working, stocking the shelves and supplying the grocery stores with the food that they need. So that's another aspect of this as well to keep in mind.
And speaking of grocery stores, you know, people are still feeling produce and putting it back because they don't like this apple or that apple. And then you go outside, and Frank mentioned this the last meeting that we had 2 weeks ago. You go outside, and then you see these masks and you see these gloves on the ground, and that's hazardous material. And yet people do this. It's just, I just don't understand it, but people do it. On the side of the streets, you can see them now too. It's pathetic, but it is what it is. That's all I had about this.
Thanks, Joe.
Frank, can I make a motion?
Yes.
I'd like to make a motion to accept the proposal as written. I don't have the proposal directly in front of me. I don't know if it needs to be read again or you did a pretty good job reading it. But I'll make a motion to accept as is.
And I
Okay.
second the
Yeah.
motion.
It's been moved and seconded and thirded. Is there further discussion now that the matter is before us?
No.
Okay, hearing no further discussion, it sounds like we're ready for a vote. All in favor, say aye.
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 Any opposed, say no. The ayes have it, and it's unanimous, so we don't need a roll call. Unanimous vote in favor. The motion is adopted. The regulation will be implemented. Brian, go ahead and do what you need to do to get the word out. And Stephen, as you would as well. Thank you.
Thanks, Frank. Just further discussion, just the board in general. Do you guys want to give us a rundown as to what you guys are seeing professionally right now?
Yeah, I have a couple of questions I'd like to address. Well, one question I'd like to address to Dr. McMillan and Dr. Scanlon on our board. During this pandemic, hospitals have postponed physical exams, elective surgeries, and we know that this is only going to increase pain and immortality. The question, certainly from your perspective, is what's the magnitude? Do you have a gut feeling of the magnitude of this increase in pain and mortality? Because it's going to happen, and it's happening right now. So I open it up to either one of you, because you're out in the front line all the time. Some of us are, many of us are not.
Frank, do you want to take a stab at it or you want me to?
I'll take a stab at it. So Joe, we actually know that. The reason that we canceled a lot of elective procedures was to make sure that we had capacity in the system to take care of critically ill patients. And so we canceled a lot of elective procedures that may result in some morbidity and possibly even mortality because we don't know what we don't know. When I do a screening colonoscopy on a patient who's age 50, it's not common to find a cancer, but it's not like you never do. And so we've been very careful about using what data we have, and our data is limited, but we do have some studies from the VA that tell us what's the consequence of postponing maybe not emergency care, but elective care. And by elective, I mean things that can be scheduled. Emergency care is something that cannot be scheduled. The elective care, though, is still necessary care, and your point's well taken. And what we've determined is about 6 weeks or so is a tolerable suspension. And beyond that, it depends on which disease state you're talking about. Some diseases you can suspend caring for 6 months. Some, 6 weeks makes a difference. But we're kind of at about all of these regulations and suspensions went into place about the middle of March, and we're, towards the middle to the end of April. So we're kind of still within that 6-week window. I can tell you that my system is starting to call back the urgent electives. So we are calling the urgent electives in to start getting their procedures for a lot of reasons, as you have suggested, that the patients are in pain and that the physicians are very concerned about people not getting the necessary care that they need. So the problem that we're having is there's a lot of patients are reluctant to come into the hospital to receive that care, and so we're altering our procedures, our operating procedures, not so much the procedure itself, but how we get people into the hospital to do so in a way that's as safe as possible. And Joe, I can tell you that if you come into the hospital or my office for any service, you're going to be wearing a mask for the entire time that you're there, and so am I, because we know that I might see 30 or 40 patients a day. If I'm sick and I don't know it, I don't want to have given it to 30 or 40 people.
Thank you. How about you, Dr. Scanlon?
So I'll take a slightly different approach and talk more about just routine office visits. Our division in Manchester has reached out is at about 70% capacity of reaching out to routine patients for either using telemedicine, which is video conference calls, or by telephone. And the feedback from patients has been actually really good. If there's deemed to be any urgent procedures, such as CAT scans, chest x-rays, we make the appropriate accommodations so patients can get in to have those things done urgently. But if it's non-urgent, we do push it back. I will say that New Hampshire is not seeing the amount of COVID patients as what Massachusetts is. Now the newest predicted surge into New Hampshire, they're talking about towards the end of June, but it will not be anything that will exceed capacity of the medical system within New Hampshire. And same thing with what Frank his system is doing. We're starting to reopen to semi-urgent procedures to be done within the next few weeks. Nothing is set in stone yet regarding that for our system.
Thank you. Right before the meeting, I was listening to the president's daily briefing on the coronavirus and his staff, and additional information that I had not heard before, which is the effect on the coronavirus of heat, high humidity, sunlight, that is UV light. The half-life of the virus, the data that they have shows that the half-life is reduced from hours to minutes. So if it is, as it appears, as the weather gets warmer, hotter, that should have an effect upon the virus. The virus should diminish, as happens with flu and pneumonia right now, as the weather gets warm. So you may not all be aware of that. I wasn't, but I listened to that briefing about 6:30 tonight. So that was interesting information.
Well, that's good news for Africa.
Well, yeah, but you also have to wonder about, well, what about New Orleans right now? It's very hot and humid down there, and they've had a lot of cases of the coronavirus.
Right. I think, Joe, a lot of the transmission in a lot of places is happening in the institutions, whether they're nursing homes or prisons or group homes, things of that nature. And unfortunately, there's some really vulnerable people in those places, and they've been the ones that this has been absolutely brutal. You know, we see the death tolls. You know, the asymptomatic person in the community, we do have to worry about them, not because we're worried about their health. We're worried about them spreading it to somebody who's vulnerable.
Yeah, last meeting I said that the average age is 81, person that dies of this virus. And additional information since that time, it looks like the average age is lower, but in the mid to upper 70s. So that's not good. And of course, they're talking about other problems like diabetics, diabetes, hypertension, or obesity. And of each one of these three, there's an excess of 100 million Americans. You put them all together, and they come down with the virus, and you're not going to do well. And these three are interlinked with each other too. But like obesity, for example, in the United States, for people that are over 20 years old, is about 40%, and there's an additional 32% of the populace that is overweight. So these are reasons, because these numbers are high in the United States, if not highest in the United States than anywhere else in the world. And these are reasons that contribute to the high number of coronavirus infections and deaths. And of course, what are you going to do? I mean, right now we're talking about 20% or so of the populace that's unemployed. And I was reading recently that for each % increase in unemployment, the deaths for varied reasons increase by 5 to 10,000. So if you're talking about 20% increase in unemployment, you're talking about an additional 100 to 200,000 deaths a year, which is more than the coronavirus. So it doesn't appear to be a good answer on anything, although I do like what the government has done so far, which is to keep people in their place so that the hospitals are not overwhelmed, so that the PPE can be manufactured, so that the testing can continue, and hopefully there'll be a cure in the not too distant future. Hopefully there'll be a vaccine. But then again, I read that there may never be a vaccine.
Well,
Can't comment.
That's why contact tracing and testing is going to be very important.
Oh, absolutely. Yeah.
So
Can I?
Go ahead.
Can I ask a clinical question for the doctors out there? Is there any conversation regarding the effects of people who are positive with COVID and who are in the hospital, and putting them in the prone position where they're sleeping on their belly as opposed to sleeping on their back? I'm just kind of curious, because I know some of the hospitals in Boston are trying to get patients sleeping on their stomach a lot sooner in their hospital stay, and I just wanted to hear if there was any conversation regarding that.
I'll defer to Dr. Scanlon.
Yeah, I'll take this one. So there actually is, so the data about prone positioning actually dates back quite a few years. There's a disease process in the critical care world called ARDS. It's either acute or adult. Now it's acute respiratory distress syndrome, where it's almost a profound inflammatory response within the lungs. And we basically measure it in the clinical world by your oxygen levels to the amount of oxygen that we're requiring to give you, and there's a ratio in there. But there was a study in the New England Journal of Medicine a few years ago that talked about early proning of these patients that are requiring mechanical ventilation being put on a breathing machine. It was actually shown to be benefit to putting patients into a prone position. I actually wrote the most recent protocol for my the ICU that I staff. And basically what you're doing is you're allowing gravity to work. Basically what's happening is if you're laying flat on your back, the back part of your lungs start to collapse from a microscopic level, or what we call atelectasis. And the purpose of then flipping somebody over to your belly, you're actually using gravity to then start to open that up, because it's not being compressed by your heart or by the rest of your lungs. So we're trying to open up and recruit that area of the lungs. And the data for treatment for ARDS is actually shown to be beneficial for early proning. So the rationale from that now has shifted to treatment of of COVID patients. And there's a lot of data coming out talking about different types of phenotypes of coronavirus patients, where they're almost being divided into, for critically ill, I should say, coronavirus patients, they're actually being divided into two types. And it really comes down to lung compliance, or how stiff your lungs are and how oxygen responsive patients are. And most patients are coming in requiring only a little bit of oxygen, and their lungs are compliant. They're not very stiff. They move very easily. But the concern is that some of these patients, with their immune response and their profound immune response, causing a lot of inflammation, where your immune system is trying to fight the infection, but there's thought that it might be doing more harm than good, causing this ongoing inflammation. And they're switching almost to a second type of phenotype, where their lungs are becoming more stiff, and they're starting to fall into this more ARDS type picture, where they're requiring a lot more oxygen, requiring to be put on a ventilator. And that's where the severely critical ill population and percentage of patients with COVID are more falling into that require ICU level of care. I will say that from personal experience and being in the ICU, I have asked patients to self-prone themselves or self-rotate themselves. There has been some positive response to that. There is no protocol to that, because all the protocols we have for that are on patients who are sedated and on a mechanical ventilator. But we're just kind of flying by the seat of our pants and having patients just routinely every hour or so rotate from their back to their belly or to their side, kind of going all different positions. But the design of it is to try to recruit more lung that could be collapsed on a microscopic level. There is some benefit to it, but again, it's kind of all experimental, like everything else we're doing.
Okay, thank you.
All right. Brian, do you have any concluding remarks, or does anybody have anything that they're burning to ask right now?
Anybody? Okay. No, I appreciate you guys going over this emergency order we drafted. I think it definitely will make an impact. I think most workers have been protecting themselves, but I think there have been a small handful that have been kind of refusing or being stubborn because they're young and invincible. I think this gives management at least a tool to require it, and I think it will do good in the long run, help protect the retail employees themselves as well as the general public. So I appreciate that, and I appreciate you guys moving on with this.
Thank you, Brian. All right. It's 7:55, and it looks like we've concluded our business. I'll entertain a motion to adjourn.
I make a motion to adjourn.
Second.
All in favor? Aye.
Aye.
No? The ayes have it. The meeting is adjourned. Thank you, everybody.
Thank you.
Thank you, Frank. Thanks, guys.
Thank you.